Good evening, friends. Today we are going to discuss a very important chapter in the management of type 1 and type 2 diabetes. And this particular chapter has acquired an enormous interest by a lot of people because it deals with three important aspects of physical training of a diabetic patient. Number one, the regular physical exercise. Number two, the sports training. And third, whether the diabetics can participate in competitive sports. Now, it's very important that the sports, particularly for children, has acquired a major role, as much important as much as academics. And there are many areas where children want to participate with various sporting activities as a syllabus. In fact, that's a good thing that is happening in our country, that people are taking sports seriously, because Modi ji says that this country has got 65% young people. Now we want the young people to be healthy, robust, not only mentally, spiritually, but physically, so that our country becomes a very strong country and we have a strong young people who will bring up the country's name. And that is the reason why I am taking a special efforts in talking about role of sports in management of diabetes. Now there are situations which I'll describe in two chapters. The first chapter that I'm going to discuss today is exercise therapy for type 1 diabetic. As you know, type 1 diabetics predominantly affects the children above the age group of 5, 6, 8, and these are the children who are actively involved in sports. Now there are many sports which can be done by an individual without a teamwork. But teamwork is also a very important part of sports. Solo sports, yes, it can develop your muscle, it can develop your concentration, but playing in a team builds up bhaichara. It takes your ability to mix socially, and you feel yourself as a normal person. You imagine a type 1 diabetic who takes 3 doses of insulin. If he is allowed to participate in his school sports program, he feels so normal. He feels that he is not a very special child and he can live like a normal person. One example I give to people of Wasim Akram. He got type 1 diabetes at the age of 14 and he took 500 wickets. Look at an example. So if there are people like this who can live a very comfortable sporting life in spite of type 1 diabetes, we must offer this to all our type 1 patients. But there are certain norms, certain methodology, certain scientific ideas which to be implemented very intelligently, and the best person to guide these young children is the school teacher, the classroom teacher, the friends, the elder brothers or sisters, and parents. And they should take more interest in them pursuing their sports without getting hurt or without sustaining major injuries. So the first sport which I recommend, which is of a great value, is jogging. Jogging is that way a sport which can be participated singularly. A person can jog on his own, but there are certain restrictions or certain disciplines that he has to manage. First of all, he has to wear very loosely fitting clothes, not fashionable jeans or fashionable slacks. He should wear comfortable clothing which should allow his joints to move freely without causing undue friction and rubbing. particularly in groins and in knees and axillas, because the skin folds can become vulnerable to the slightest trauma and can got abrasions and injuries and can get infected. Next, attention should be paid to the shoe wear. The shoes should be comfortable, they should support the arches, they should support the ankle, they should be fitting not snugly but properly, not too loose, not too tight, and you should wear extremely comfortable socks which should be washed every day and ironed slightly so that all the folds are removed. And after you put the socks in the shoe wear, you should be able to put one small finger behind your ankle so that there is sufficient room for expansion during brisk walking or jogging. Once you have a comfortable shoe wear, once you have a comfortable gears. Now, another thing which I always recommend to a person who are either doing a two-wheel driving such as cycling, they should wear helmet. A nicely fitting helmet is a must because of falls from bicycle by any chance should ever hurt the head. You should avoid head injuries. Then they should have running goggles because of the breeze and can cause abrasions in the cornea. They should have not a mask but a running goggles which can be used against the water current or against the flow of the air. Now, the pace at which the child should walk or jog should be reasonable. And there should not be a feeling of competition, because what happens when the children go for jogging, there is a sense of competitiveness. They see a very young, fit person, and particularly in their adolescent group, they see a female passing by them faster, they try to chase that person. That should be avoided because that female must be absolutely fit and proper and she has no disease, while this fellow has got a limitation. I don't want him to get affected by the competition, but you should not try to compete with a fellow runner because that fellow's stamina is different. Second thing, you build up your stamina. Don't start jogging first day 2 miles, 4 miles. Jog at a pace which is comfortable. Initially start walking, then brisk walking, increase the pace, maybe 2 kilometers per hour, 3 kilometers per hour, 5 to 6 kilometers per hour over a period of 15 to 20 days. Because we have seen so many young people in a competitive game, they jog very fast, and you hear that a completely fit person at the age of 41 was dropped dead because the cardiovascular toning was not done. He suddenly had a tachycardia and had a cardiac arrest. So you get acclimatized, and people who are used to sea level, if they go into mountains or uphill slopes, jogging and marathon kind of runs should be avoided. There are a lot of marathon runners in juvenile diabetics, but they build up over a period of 3 months, 4 months, 6 months. They have to muscle tone, they have to build their stamina. They cannot do it overnight. This is a mehnat of almost 1 year when they do that. So do it gradually, slowly, and don't keep unrealistic targets that I'll climb 56 steps in 2 minutes. Don't do that. Do it at a pace which does not increase your heart rate. The only way to check it, when you take a regular exercise, you have a basal pulse rate. Alright? Supposing your basal pulse rate is 70. Then your age is say 12. Right? 4 times that, another. So you can allow your pulse rate to go to 120, but not more than 120. After 120, you must stop. That is one restriction you have to observe being a diabetic, because your autonomic nervous system is also affected, and therefore sudden bout of number of beats coming per minute can cause some atrial abnormalities and can cause arrhythmias, and that can create problems even in a young person in type 1 diabetes. And type 1 diabetes of a long duration, they have some amount of autonomic neuropathy. Their correcting mechanisms of heart rate going as per exercise is also not there. So do it slowly and steadily, but with a feeling of well-being. Now please remember, type 1 diabetics who are taking insulin, they must find out after about 10 minutes of exercise how much blood sugar has dropped. They have to do two testing before going for any exercise for about 20 minutes. They must check the sugar. After 10 minutes, they must check the second sample. After 20 minutes, check a sample. Find out if there is a rise or a fall. Sometimes the blood sugar can actually rise, and sometimes you must need to check the ketones after exercise. Many times the person gets dehydrated, and the dehydration produces ketosis, and that's the reason why after running for an hour, if your urine shows traces of ketones, that's an indication that you are dehydrated, and dehydration occurs in a climate which is unsuitable. You are used to a particular temperature, say 36 degrees or 34 degrees, but the temperature goes more than 36 degrees. You do what is known as imperceptible perspiration. You don't sweat, but you lose as much as 1.5 liter of fluid from the body. So you have to keep on drinking water. Many long distance runner, they keep a small bottle of water and keep on sipping the water so that you prevent dehydration. Second thing you have to look for, that after certain amount of exertion, whether you get any cramps, particularly anti-gravity muscles, quadriceps, hamstrings, calf muscles, and the toes turn on each other, the feet becomes squeezed up. If that happens, you have to do a gentle massage. You have to stop doing exercise at that time and improve your calcium intake and improve your water intake, as well as improve your sodium and potassium intake. So ideal thing is to take a limbu pani with little salt and drink about 1.5 liters water after exercise. That will control your dehydration, and that will prevent all these metabolic abnormalities which occur in type 1 diabetes. Now this may sound little elaborate, but this has a lot of scientific basis which I am trying to say. And if you follow these norms, and any cuts, callosities, any non-healing ulcer, any problem in the knee joint, any strenuous movement of the joint, if the joint feels stiff and there is a swelling of the joint, it's a no for jogging and brisk walking. Then you should do non-weight bearing exercises. You can sit down, do leg curlings, do static quadriceps, or the best non-weight bearing exercise is swimming. There is no stress on the knee joints or the ankle joints. And if you feel your knee joint is sore or ankle joint is sore and there's a bit of stiffness, you must not jog or walk. If facilities are available, there is nothing like swimming. It gives you tremendous ability to breathe. Your breathing capacity improves, and it is a non-weight bearing exercise. But to develop bones and strong, powerful spine, you need a weight bearing exercise. And therefore, weight bearing exercise like jogging, walking are definitely beneficial for a strong bones. But when the bones are sore and the joints are hurting, you should not do weight bearing exercise. Then there are resistance exercise. A lot of young boys like their muscles to, look like this Arnold Schwarzenegger and all this muscle they see. And it's very natural because they want to impress their girlfriends and things like this. So they do exercise. Now remember one thing, resistance exercise is good for developing sarcopenia. A lot of diabetics have sarcopenia, means muscle mass is shrunk. In order to increase the muscle mass, the drug is insulin. After taking insulin, the muscles become flabby and you put on weight on the abdomen. In order to avoid that, and you have the classical six-pack like Shah Rukh Khan, you need to do abdominal exercises without causing undue intra-abdominal pressure. You should do exercises of the abdomen in such a way that you should not have choking sensation and breathing difficulty, but you do slowly and build up muscular exercise. Use a 2 kilo dumbbell and do more frequent repetition. You do 100 repetitions with 2 kilo weight rather than using 20 kilo weight and do 10 repetitions. Because 10 kilo or 20 kilo weight and doing 10 repetitions will increase the muscle mass. There is a hypertrophy. While frequent, it will get the endurance in the muscle, and the muscles become powerful but supple, and that is the right muscle you should have. So more resistance exercise with the lesser weight. That's another guru mantra which I must tell you. Stretch exercises like pulley and things like this can be done to mobilize your joints freely, and these exercises were multiple joint involvement. Exercise of the neck, forward, backward, and exercise of the spine to twist the spine either way under a proper trained physiotherapist for few days. Take the lesson, do it correctly, and remember, after your exercise, you must get a very nice, gentle pain. Meetha meetha dard. The moment the muscles sore and they pain you a lot, that means you are doing something wrong. If the muscles get fatigued and they hurt you, that means there is something wrong with your movement and you need to change, or you have to go to a proper trainer. It is better to go to a trainer earlier, but the trainer should have sufficient maturity. Many trainers are young themselves and they want you to become a marathon runner or a Mr. Universe or something. Give them realistic goals and you tell them about your disease, tell them the fluctuations of sugar, tell them your need of taking insulin, tell them the chances of hypo if you do unaccustomed exercise. And if you feel funny or dizzy or giddy, check the sugar immediately. Help yourself with a sugar drink and cut down on the exercise that day. Find out at what level of exercise your blood sugar drops. Please remember, every time the same exercise may not drop all the same level. Means your blood sugar is 200, it will come to 100 by jogging for 500 yards. It doesn't happen all the time. It is variable. So it is better to have a frequent monitoring, and a lot of people, I recommend them, particularly type 1 diabetic, the use of CGMS, is continuous glucose monitoring system, keeps on recording all the time, and you can keep on checking your sugar, and you know yourself that if I do this and if I eat this, my sugar goes up or goes down. You have your own logbook, and that will help most of the type 1 diabetics by getting a good exercise. The basic role of exercise is to build up your immunity, you build up your endurance, and most important, it should give you feeling of well-being. It should give you mental high, because exercise produces body's morphine known as beta endorphins. People who take regular exercise, they have their own high. People who are exercising regularly, they can face any situation. They are not depressed with calamities, or they are not depressed with financial losses. They say, okay, I'm dekhenge. People who do exercise, they have a wonderful smile on their face, their complexion glows, and they live very healthy and a very fruitful life. So this is my guru mantra for type 1 diabetes.